project is on hyperlipoproteinemia. The statistics for patients who have hyperlipoproteinemia is the highest with those who have premature coronary artery disease, or CAD for short. It is more common in white people than it is in dark-skinned people. So the women who have it are 49 to 64% of having it or have already had it. Men have 56 to a 78% chance of having it or have had it. Children or adolescents have 20% or higher of having it. So children who are under the age of 2 years old may also develop this disease if they are either obese or underweight. So children should be screened for high cholesterol between the ages of 9 to 11 years of age. Over the years, there is an increase of hyperlipoproteinemia in children and adolescents. So for the definition and the conditions for this disease, it is a condition which is the inability to break down lipids or fats in the body, mainly cholesterol and triglycerides, and there are many types of this disease. These two substances can seep into the blood vessel walls and restrict blood flow, and this can create risks of a stroke or a heart attack. The conditions for this disease is to get routine blood tests, and it is recommended every 5 years for adults. It is also recommended every 5 years for children and adolescents when they have been screened for it. So by having too much cholesterol in the body, it can collect in the arteries and form a type of plaque, which is a lesion in and on the outside of the artery. For the signs and symptoms, hyperlipoproteinemia does not cause or show any symptoms because it is asymptomatic. However, hyperlipidemia, which is the same disease, does have symptoms, which are chest pain and pressure, heart attack, high blood pressure, stroke, abdominal pain, or enlargement of the liver or spleen. There are many other symptoms as well. As you can see from the picture beside, those are shown to have been caused by hyperlipoproteinemia, which are fatty bumps and can lead to rashes as well. However, even though this is a disease that might develop over time, it can also be a genetic disease as well that you could have possibly been born with from one of your parents having it.
Okay. So some tests and diagnosis of hyperlipoproteinemia. Different types of hyperlipoproteinemia can be tested for and diagnosed, and most of the time it's done through blood tests. These blood tests test the lipid levels in your body, LDL, HDL, all those good ones, as well as family history. Uh, as talked about before, hyperlipoproteinemia is a very genetic disease, and so looking through your lineage and family members that may have had it or did have it can help you narrow down whether you do or not. And then another one, which was shown in the picture earlier, are lipid deposits on the body. So you could see them in that picture, the bumps on the fingers. Other tests that can be done to diagnose related comorbidities include more blood tests, but specifically blood tests that test thyroid function, specifically the hormones that control your thyroid, glucose levels in your blood, which is the amount of sugar in your blood, as well as liver function blood tests. And these are through ALT and AST blood tests. You can also tell whether you may or may not have lipoproteinemia through protein in the urine. While there are a lot of other causes for protein in the urine, hyperlipoproteinemia does cause an excessive amount that your body is trying to get rid of, and therefore will try to have it exit the body. Another one is uric acid levels, and this can be tested through the blood or urine, and it assesses your kidney function. My first two current research articles are, the first one is Therapeutic Apheresis for Management of LPA Hyperlipoproteinemia. And this study said that most lipid-lowering drugs that are currently available on the market are unable to fully abolish or get rid of lipoprotein pathogenicity. However, lipoprotein apheresis, which is newer, has been shown to reduce it more permanently. Apheresis is used to remove the LDL from a patient's blood, and it's done through the same type of machine as when you get your blood drawn, when you donate blood and you choose to donate plasma. It's the same. It separates the LDL, it gets rid of the LDL, and then transfuses it back into your body. After a few months of this lipoprotein apheresis, inflammation and prothrombotic processes were shown to decrease, and in 2 to 5 years, it has been shown to decrease risk of cardiovascular events. This, however, is only approved in some countries as of now, and the United States is not one of them. The second article is called "The Epidemiology and Associated Risk Factors of Hypolipoproteinemia." And this is a study done in Dresden, and it found that hyperlipoproteinemia was found to have a 7.4% frequency as a risk factor for ischemic heart disease. It's been shown to disrupt the carbohydrate tolerance that your body has, which leads to hypertension or high blood pressure. With help of apoproteins, we may be able to assess the metabolic risk more exactly, and this would be done by determining the lipid values by classification. This could help us determine exactly which lipoproteins are involved in the different types of hyperlipoproteinemia and which ones are most likely to cause harm. That way, there's no need to remove the healthy ones, the ones that aren't really hurting you, and just the ones that are causing it. The third research article is called "The Clinical and Laboratory Investigation of Dibeta Lipoproteinemia." Familial dibeta-lipoproteinemia, or type 3 hyperlipoproteinemia, as it's also called, is potentially underdiagnosed, despite the fact that it has a large association with an increased risk of coronary and peripheral vascular disease. The implementation of something called ApoB as a diagnostic pathway can lead to more detection and diagnosis of this disease, which is very important because the faster and the more we can detect this familial dibeta-lipoproteinemia, the faster we can try and cure it, which would decrease the risk of coronary and peripheral vascular disease. The fourth research article is called "Pregnancy-Induced Hyperlipoproteinemia," and it basically says that when you are pregnant, your hormone levels change, and this change can lead to an increase in the plasma lipid levels, increasing their risk of developing a type of hyperlipoproteinemia. While women can develop it during the pregnancy, most cases develop later in life, after she is given birth, whether it's herself that gets it, or her child, or both. My fifth research article is called "Low-Density Lipoprotein Apheresis is Associated with the Removal of SARS-CoV-2 Antibodies." A study was done to show the relationship between lipoprotein apheresis, which we talked about earlier as a potential treatment for hypolipoproteinemia, and the antibodies from SARS-CoV-2. The study showed that lipoprotein apheresis also can remove the coronavirus antibodies, and that this average elimination rate was 21.2%. In the present population of patients undergoing this apheresis weekly, however, the elimination didn't lead to an inferior concentration compared to patients not undergoing lipoprotein apheresis. So what this means is that there is something that shows that lipoprotein apheresis can potentially remove coronavirus antibodies. It is not 100% proven, and the research is still ongoing with this. And my last current research is called Therapeutic Management of Hyperlipoproteinemia. And this states that cardiovascular disease is the leading cause of death worldwide, and especially in America nowadays. And severe clinical and epidemiological studies have demonstrated that an elevated plasma concentration of lipoprotein is a major risk for the development of CVD. This makes reducing hyperlipoproteinemia even more important to treat. Some of these therapeutic managements that the research article talks about includes the prescription of things like aspirin, niacin, estrogens, and statins. And then some of these therapeutic managements are still in the trial phases, and those include things such as proprotein convertase inhibitors, LPA apheresis, which we've talked about a couple times now, and antisense oligonucleotides.
Hi, so my name is Sarah, and I'll be talking about the diet recommendations for this condition and what is recommended to keep patients diagnosed with this condition healthy and to get them on the right track to being their best selves. So some of the recommendations from nutritionists and doctors and stuff are to reduce the intake of saturated fats and trans fats. And within that, you want to limit saturated fats to less than 7% of calories and eliminate trans fats altogether. You want to increase the intake of poly and monounsaturated fats. And a good way to do this is to replace saturated fats and trans fats with poly and monounsaturated fats. So, that's pretty self-explanatory. You can look up what those are if you need. You would also want to increase the intake of soluble fiber, which is and you could do this by getting 3 ounces of oats per day or taking a psyllium supplement. I think that's how you say it. So you also want to increase the intake of soy protein, and that could be done by increasing 1.5 ounces of soy protein per day is the recommendation. And you could use tofu and soy foods to replace meat. And obviously within that, a big thing is that you limit alcoholic drinks to 1 or 2 per day, just to make sure you don't go overboard. And you also would want to increase intake of omega-3 fatty acids from marine sources, so like salmon, stuff like that, fishes. You could follow a Mediterranean diet, which is within the Mediterranean diet, olive oil is the main dietary fat. You have limited amounts of red meat, dairy products, eggs, and poultry, and increased amounts of vegetables, whole grains, fish, and tree nuts within the Mediterranean diet. I personally have researched the Mediterranean diet, and I feel that it is a really good option for a lot of people with a whole range of conditions. You could also follow the portfolio diet, which is a mainly vegetarian diet, and within this diet you get your protein from vegetables, almonds, and soluble fibers and stuff are a main portion of the portfolio diet. So for the 5-day menu, there are so many ways that you can get all of that in. And for example, some of the meals that I came up with, for breakfast one day, is 1 serving of southwestern eggs with 2 slices of whole wheat toast, and that would have a whole lot of protein, not many calories, not many carbs. And an example of a lunch would be 2 hummus and veggie sandwiches, and an example of dinner would be 2 servings of veggie and chicken salad. So that actually sounds really delicious. And then another example of breakfast would be to have 1 serving Greek yogurt with blueberries, walnuts, and honey. So you're getting all of your nutrients and eating balanced meals. And then another example of a lunch would be 1 serving basic green salad, mixed green salad with peanut butter and celery, and that would be like 4 stalks of celery with around 4 teaspoons of peanut butter. You're really just trying to make sure you get all of those nutrients in a balanced way in order to keep the trans fats down. And